Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll, here at the International Conference on Nutrition and Medicine. And today I want to talk to somebody who has really, over the past 2.5 years, been taking a close look at the pandemic, COVID-19, and diet. How does what it is you're eating affect your risk, your outcomes of COVID-19? This particular doctor has done more in the past 25 years than you or I probably will have done in a lifetime, many lifetimes, as a matter of fact. It's such an honor to be sitting here with Dr. Sara Seidelmann. Thank you so much for being here.
Thank you for having me. I'm happy to be here.
I'm happy that you are here as well. We still are very much in the throes of this pandemic. Obviously, back in person, return to normal, more or less. But you still look at the numbers. Last I saw, we're still here in the U.S. looking at roughly 100,000 cases every day. That's a lot of people still getting sick. What do we know about the connection between what it is we are eating and COVID-19 and what we're seeing there?
Sure. Well, I think we could take it back even further to the relationship between nutrition and infectious disease, which...
Right.
Anecdotally, for hundreds of years, we've seen this relationship between malnutrition and risk of developing an infectious disease. We would see this in times of war, in times of famine, right? When suddenly food supplies were cut off and infectious disease would flourish, right? So we've known that for long periods of time, right? How many stories have we heard about that? So there are parts of this that are obvious. I think the part that isn't so obvious is that as you take that into current times, the way that we think about malnutrition historically has been in the undernourished, right?
Right.
They're underfed, undernourished. And now we have the opposite. We have the overfed, but undernourished.
Yeah.
So, according to the CDC, currently a third of all Americans, children and adults, have at least one basic nutrient deficiency. United States of America, now.
1 out of 3.
1 out of 3.
In the U.S.
In the U.S.
And I love the way that you put it, overfed and undernourished. That's such a foreign concept. I think that a lot of times people can go wrong thinking about, well, it's food. If I just put something in my belly, I'm going to be okay, right? Mm-hmm. As long as I feel full or put something in there, I'm getting everything I need. Mm-hmm. Clearly, nothing could be further from the truth.
Clearly. So, we're in quite a state here where very early on in the pandemic, we were seeing the association between obesity, type 2 diabetes, atherosclerotic cardiovascular disease, hypertension, increasing risk for COVID-19. All of those illnesses are nutritionally driven illnesses.
Right.
As a cardiologist, battling the primary type of heart disease, which is atherosclerotic cardiovascular disease, this is almost entirely a nutritionally driven illness, right? And so in retrospect, it seems kind of obvious that nutrition would be very important in COVID risk because all these nutritionally related illnesses put us at risk. The study that I carried out, it was very early in the pandemic. Mm-hmm. We really needed to try to get at healthcare workers that were exposed to the virus. That was a challenge because there weren't that many cases. At the time that we launched it, there were about 1.8 million cases globally. At the time of its inception, less than that, right? And so we really focused on frontline healthcare workers. We had to go bigger than the United States. A lot of those cases were in Europe at the time. And so we looked at 5 countries in Europe as well as the US, and we really had to use a large network of 1.5 million physicians in order to capture some of those that were most at risk.
how did you reach 1.5 million? I mean, that's the study, right? That's an undertaking.
So I like to think of it as a very creative, kind of scrappy COVID story where it was a collaboration between academics and the private sector. So we approached a company called Survey Healthcare Globus. They had this large network of physicians in order to do market research. And we said, hey, would you ever consider letting us do academic research with your population? And they were amazing. They were incredibly supportive. Not only were they open to it, but they funded it. So I'm so grateful to them for doing it. And I'm grateful to the healthcare workers who took the time out from what they were doing, which was battling the pandemic, to take part in this.
Do you think they took the time out to do that because they knew the importance of the data that was being accumulated?
I think physicians in general, and particularly these physicians, I mean, they're true heroes. We are always thinking about, and there's a certain part of you that has to let self go when you become a physician because you're thinking about the greater good.
Right.
You've committed yourself to helping people in general, and so there's something that naturally I think physicians, nurses, physician assistants, that healthcare workers do because they believe in the greater good.
So what did the data kind of bore out here? What were some of the things that you discovered?
Well, so there were some things that were obvious, like more exposure to the virus puts you at risk for getting the virus. And so that's great because we saw things that we expected to see. Greater access to PPE. At the time that we were doing this study, there were many physicians who didn't have access to PPE and they were still showing up to take care of patients. So the better access that they had, the more types of PPE that they had protected them. And then we looked at lifestyle factors. And sleep and stress were a big component here. The better rested, the less work stress, personal stress that they had, the better that they did. And then diet was a big component as well. So we looked at plant-based eaters. We looked at plant-based and pescatarian eaters, and we looked at the other end of the spectrum, which was the low-carb, high-protein diets. And what we found was that plant-based diets were extremely protective from developing severe COVID. So those healthcare workers that followed those types of diets had a 73% lower odds of getting severe COVID. When you compared those to the meat eaters had a 4-fold higher risk of developing severe COVID.
The risk of becoming infected, that was pretty much a level playing field or level across the board, but once infected, the risk of severity, that's where there was the huge difference, right?
Yeah, bigger relationship. There was a trend towards individuals contracting the virus less, but that was a smaller relationship that when they got it, that they had a less severe form of the virus.
Does that go back to the plant-based diet being largely anti-inflammatory? Is that kind of what the hypothesis was there?
I think that this is multifactorial. I think that these are areas where I hope that people dive in more to the research, but we hypothesize that it's due to several factors. One, we know that plant-based diets are higher in micronutrient content, and so levels of vitamin A, vitamin C, for example, are higher in these types of diets, and we know that we know from past work and work in basic science that micronutrient deficiencies increase susceptibility to other viral illnesses like Coxsackie virus, influenza. And there's some interesting basic science data to suggest that actually changes the genome of viruses as they enter the host and make them more virulent when they're entering the host of a nutritionally deficient individual. So I think that could be one component. The other one, which is really gaining a lot of traction and more data, is in the microbiome. We know that plant-based diets are higher in fiber, right? Because it's just a simple relationship. Animal-based proteins have zero fiber, right? And the standard American diet, which is literally breakfast, lunch, and dinner, meat with a side of cheese or meat with a side of meat, right?
Yep.
So we could just run through it, like, eggs and bacon in the morning, right? It's like meat with a side of meat. Lunch, cheeseburger. Okay, meat with a side of cheese again, and then dinner, steak. There
it is. Yep.
Steak with broccoli with cheese on it, maybe you got a veggie in there. The typical American diet is very void of fiber, right? We're really fiber deficient. And fiber is important because it's the stuff that we can't digest. It goes down to the lower parts of our gut, and our microbes digest it, right? And that's the stuff that they live on. And really, the way that I like to think about it is that every single day, why is the gut so important, right? Why does the microbiome even matter to, as one person asked me today, why would that matter to a respiratory virus that you breathe in?
Yeah.
The way that I like to think of it is that every day we are inviting the outside in through the GI tract, right? And so with every bit of food that comes into your body, that could have bacteria that come with it, it could have viruses that come with it. And so our gut is constantly working to keep the outside and those pathogens out and us healthy and safe, right? And the frontline workers there in the gut are your microbes. They're sitting at the intestinal lining, making sure that the integrity of the intestine, is superb, because that's their home, right? That's their local environment. And we know that 3/4 of the immune system is located at the level of the gut. That's what's estimated. And so as you have an unhealthy gut, as the immune system has to do more work there, I imagine that it would detract from what the rest of the body is capable of.
Sure.
That you can't have all your soldiers everywhere, and if they're completely focused on the gut, then a respiratory virus has a longer period of time to take hold before your immune system can fight it. So that's the way that I think about it in my mind. I would love to see more research, more work around it. But that's the hypothesis, and how the diet is helping us.
Let me ask, we're now obviously 2.5 some odd years into this pandemic as we record this. Have there been any studies, any research done on the effect of diet quality, lifestyle quality, and long COVID? We're hearing a lot about these long haul cases.
I don't know of any right now, but I think that there is opportunity in some of these cohort studies. Nurses Health just recently published, just this month, just a few days ago, their association between diet and COVID and their population. That may be a place where they could study long COVID symptoms, but that would need to be done in a group of individuals that you follow over time.
Of course. So
currently I don't know of any, but but if you get back to the beginning, which is that, if you're less likely to get it or you're less likely to get a severe form of it, you could extrapolate that probably you decrease the chances of having long-term symptoms from it, right?
For sure. So where does this research go from here for you? What are you keeping your eye on?
So for me, I think that really understanding the larger relationship. What I'm excited about is the resurgence of interest in nutrition.
Yeah.
And as it relates to infectious diseases, and so not just COVID, but I think really understanding the relationship with all kinds of infectious diseases.
Yeah.
Influenza is something that we battle every single year.
Yep.
And is so important to understand. I think that we're seeing all kinds of infectious diseases come out now. Between monkeypox and polio is becoming an issue again, and we're going to be seeing over and over and over again all kinds of infectious diseases come out as we live in this global environment, as we're living closer and closer together.
Yeah.
Right? And so if we can get to modifiable risk factors for not just all infectious diseases, but cardiovascular disease, diabetes, hypertension, right? Nutrition is really a unifying, root cause kind of problem that solves so many others. And so as we can get more data together, as we can provide policymakers with more data, as we can give more information that can inform policy, that can begin to really build change on a population health level. That's where I see my efforts in the future.
Final question. It sounds like you kind of already answered this, but would you say that if somebody were to make one change to improve their health, really increase their immunity or risk of COVID-19, bring that way down, that one change that they should be doing is really focusing on improving the quality of their diet?
Yeah, look, I'm a believer in vaccination, right? So if all of those other things are there, we need to reduce risk. So don't go into high risk kind of situations. Do the basic things, but in terms of things that you can modify in your own life and control that can change your risk for not just infectious diseases, but a whole spectrum of other diseases: cancer, cardiovascular disease, hypertension, dementia. There are few things that you can do for your health that are more important than what you put in your mouth every day. And so increasing the amount of vegetables, increasing the amount of fruits, making sure that you have legumes and nuts, and a variety of fresh foods, whole grains in your diet. There are a few things that you could do to improve your health that would be more powerful.
All right. Dr. Sara Seidelmann, thank you so very much for your time.
Thank you for having me.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.